In our last video, we talked about some of the common things that we see and hear that makes us think that when you have a shoulder issue that it's actually coming from your neck. We know that 47.6% of shoulder pain actually comes from the neck. And this is often something that is not screened. And so if you want to learn more about what some of those things are, you can definitely check out our other video. But we're going to go through kind of our baselines, common things that we see with our baselines, and some treatment to determine if the shoulder pain is actually coming from your neck. So the big baselines that we look at for this, one thing, in our evaluation, there's a lot of questions that we ask. And one of the big questions we ask is, what makes it worse? What makes it better? And so some of the common things are, that we're looking at are, when I'm sitting in front of the computer, it just kills my shoulder. Well, you're sitting, you're not really using your shoulder. That gives us an indication that there's probably something going on in the neck because your shoulder is killing you when you're sitting. But what happens when we sit? These are oftentimes we're looking at the computer and our head's tilted forward. We're looking down a little bit at our hands. We're turning our head off to one side. These are common things that we do when we're sitting in front of the computer. And when you do this for a long period of time, it can make those joints stiff, specifically in the neck. And a big common place that it refers to is the shoulder. And so we've really got to rule these out. So if we can find out I feel better when I lie down on my back. Okay, when you're lying down, you're in more of a straight position, a little bit, you could be even almost a little bit more extended. Just understanding the patterns of every time you do something and you're flexed, it hurts. And there's positions that make it better, which makes us every time we're in a good posture, our heads to kind of tilted back, then it makes it feel better. We know what direction we need to go into. We don't want to do things that make us flex going forward, if that makes sense, because that's the position that we're always in, and that's making the shoulder hurt. So just understanding what makes it better, what makes it worse, gives us indications of, okay, I know what direction I want to start with to improve your range of motion. And almost always, I'm going to say 80% of the time, usually this exercise that we're going to start giving you, that we're going to show you, will work, because most of the time, what we do throughout the day is we're looking down on our phone. We are, looking at the computer. We're down, cleaning the house, and our head's always tilted down. That's what we do a lot of the time. And our joints don't like being in those positions for long periods of time. And the way for us to make them flexible again is to kind of go in the opposite direction so that we can rebalance everything initially. So the big common baselines we look at when someone has shoulder pain is we just look at shoulder range of motion. So we'll look, and a lot of times overpressure gives us an indication, because you'll have one side that will go woo, really far back, and then it's hard to test on me. And then you'll have another side that's ooh, it looks the same, they look the same, but this one isn't moving, it's really stiff. So giving it some overpressure really does make a difference. So you could have a friend, okay, I want you to just give me some pressure in the shoulder and let me see what it feels like from one side to the other side. We'll do flexion, same thing, and we'll give them overpressure. How does it feel when they do that? Is there a limitation? Is one joint springier and the other joint really stiff? We'll look at shoulder extension and see, is there some commonalities? A lot of times shoulder extension is not something that is limited with neck, but it can. We've seen it before, it definitely can. We will look at, functional internal rotation and see what are the differences between the two, if there's anything there. So those are common limitations that we look at in the shoulder. And then when we look at the neck, we want to look at rotation and just giving a little overpressure. How does it feel one side versus the other side? Is it springier on the other side and it just kind of stop on that side? Those are things that we want to look at. We'll look at extension, looking back. We'll look at flexion and just kind of seeing what are the symptoms? How does it feel? We'll look at side bend, and then we'll look at the other side bend and kind of just feeling the differences between each side. So those are things that we look at from the neck. And then we look at inhibition, which is that there's common patterns in the joints that will give us weakness. And for the neck, it's wrist extension. So one side will be strong, and the side that we're having issues will actually be very weak. Same thing with external rotation. That can come from the neck. Now, if it's a shoulder issue, the only inhibition is external rotation. So they'll be weak through here if it's inhibited. But if it's only this and you're pretty strong in the wrist extensors, then you're starting to think, yeah, there might be a neck component, because normally you'll have wrist extension for the neck, wrist extension tightness or weakness, and external rotation weakness. So those are two things that we look at. And again, when the body doesn't move, when joints aren't moving, it basically has, like, the neurological system has a way of like going, nope, don't do that. Nope, I don't want you to do that. And that's why you'll get some of that inhibition. It'll come back like that, like instantly, because once you get things moving again, all of a sudden you're like, boom. So it gives us some quick information to know, like, we're moving in the right direction. Now, a lot of the tightness that people feel, the muscle tightness, that's protection. Now, if you go after that, you're just treating a symptom. And so you really have to get things moving. As soon as things move, a lot of that tightness goes away. Now, as everything is moving, there can still be some things that are shortened because they've been shortened for so long, and we've got to get those released, but we have to start with mobility first. And so those are all things that we look at. So we have all the baselines, and we can see there's some limitations. So what's next? So the next is doing the exercise. And so you can do this exercise. Now, we can do it sitting in a chair. You can do it standing up. It doesn't matter. So what you're going to do is we're going to start with retraction. And what you do, I'm going to go sideways. You're just going to come in and you bring the chin in and you come out. So when I give people the cue of, okay, think of like someone's coming in for a kiss and you don't want it. And you're like, no, everyone does it perfectly. That's what you're doing. So just come in and give it a little bit of overpressure, doing some retraction. We're just getting the neck to start moving. Now, when we retract, what happens? So every upper neck moves different than the middle neck, which moves different than the lower neck. And so the upper neck actually is flexing, and the lower part of the neck is actually extending. But you're only extending a little bit down low and through here, which is really the key, because anything through here can refer out into that shoulder because the muscle's attached to both locations. That's why. And so when you start doing this, it's just doing partial range, not full range of motion into extension in the lower cervical, but you are going full in the upper cervical into full flexion. I know, a lot of details. You don't really have to worry about that. Just start doing some retractions. So you'll just come back and do some retractions. So I want you to do about 10 or 15 of them, and then I want you to go back, check your shoulder baselines with overpressure, check your neck baselines with overpressure. Like, I even already feel better that direction. Check, so you're going through all the inhibition, just get someone to kind of test you as you do it. If you notice that you're improving, awesome. Let's do it again. Back into retraction, back into retraction. If you get back out of it after you do another 8 to 10 of them and everything is about the same, but you haven't progressed, then you're going to do this exercise. So it means you've gotten good to a point, but we need to go and take you a little bit farther into that range of motion. It's that joint range of motion to finish off and actually help improve your range of motion in your shoulder, take away your shoulder pain, range of motion in your neck, your strength inhibition. We're trying to get all that to come back to normal. So the next exercise that you're going to do is you're going to retract. So you'll retract like this, and then from there you extend back. And then come up. What you don't want to do is retract, come out of it, and then extend. It's a very different motion. So if I extend, I'm only extending through here. But when I get the retraction and I get through here, you're actually extending back down lower. So you retract from here and then you drop it straight back. And then you come back up, and you'll feel a little bit of a tightness as you go all the way back. That's totally normal. But as you do it, it should get better and better and better. So again, doing 8 to 10 of retraction, extension. If you're feeling confident with that, then you can add little small rotations. So here's what it looks like. Here, back, and little small rotations. Those little small rotations, just getting that last little bit of range of motion. So doing 8 to 10 of these, retract, extend, and then you'll start noticing, oh, wow, my shoulder, it actually moves a little bit better. My neck is actually moving a little bit better. My strength is there. My shoulder pain is gone. Then you know this is what I need to do. But here's the deal. You can do that exercise, but if you go back to looking down at your phone and you're always looking at the computer, you have got to adjust your daily activities and in order to fully resolve this. And so Look at what you're doing in flexion that is creating some of your issues and modify those. Make sure the computer is up a little bit higher so that your head is looking straight at the screen when you are doing anything. Don't have the screen off to the side. If you have multiple screens, stack them so that you can like look up and here versus over here and turning your head. The other things that I want you to do is doing this exercise. You need to do it every couple of hours. I want you to go in and do it 5-6 times a day, 8 to 10 of them. It doesn't take long. Dude, I've done this and like waiting at a light in my car where I'm doing this. I'm sure people are going, what the heck is she doing? I'm like, I'm doing my exercises. I've done them at like Maverick games. I'll go back and I'm like, okay, let me go and stretch a little bit. They're not that hard to do. So get 8 to 10 of them done every couple of hours during the day. And if something is like, this didn't work, it's not really, it kind of helped, but it really didn't help, then there's other things that we look at as well. And that's going to be a good time to comment below or reach out to us because we can go and guide you. There's different directions that we go with the neck. We sometimes have to go into the thoracic spine and sometimes we have to go into the shoulder. So this is really just meant to look at like, oh, how much of my shoulder pain is actually really coming from my neck? Can I rule that piece out so I can start figuring out what my next steps are or what I need to do? So again, if you like what we are sharing, make sure you like, comment, share this content because this is how we can get information out to people. Our healthcare is a mess. We look at symptoms. We do not spend time with people to figure it out. We're not logically going through this. We're looking up information on the computer versus actually using our brain. It's okay to look up stuff from the computer to go like, let me make sure, no, that's not right. But we're losing the critical thinking skills in the medical society. And I'm here to try to help bring that back and help you understand your body a little bit better because our bodies are amazing. They can heal if we give it the right environment. And there's a lot of things that we can do to help you avoid surgery, injections, and medication. So make sure you subscribe, share this with someone that needs to hear this, like it, comment below if you have any questions, and we'll see you next time.